Good morning. I'm Dr. Arvind from Chennai Plastic Surgery. I lead the hair transplant team here, and today we'll have a short discussion about how good FUE is. Let us be very clear. As far as the main hair transplant surgical community is concerned, the state-of-art gold standard system of operating is the FUT or the strip method. But in today's scenario, FUE is a number of surgeries, is the most performed surgery, and how is it competing against the standards? We say FUT is better because it yields us more stout and resilient grafts. But today we have FUE competing almost there. How does it do it? Because the systems that we use are able to provide us with individual grafts that are just as strong as the FUT grafts. How do we get them? The initial punching systems. Instead of the traditional sharper punches, we today use what is called as the hybrid punch. The hybrid punch, it combines the good qualities of a sharp punch and a blunt punch. It has a shape that is like that of a trumpet, so it can accommodate a bigger graft. When it cuts, it doesn't go close to the graft, it slides the graft up. So at the end of the day, you get graft that is not partially transected, but it has a good surrounding cuff of tissue. It even comes with a tuft of fat underneath. The punch is so good that the transection rates are less than 2 or 3%, something that I myself not believed in. And the grafts that you get are really good. The second part is using of substances and preservatives that help to preserve the graft for a long time. We use something called as hypothermosol, we use ATP solutions, we use them on a cooled surfaces so that the grafts, when they're staying outside, they stay good for a longer time. The third is how we place the graft in the front. We have been initially using the stick and place methods where a hole is made with a blade or a needle and the graft is held by hand by a forceps and is placed in. When we do this, the grafts can bend in the sides. The grafts that are splayed have difficulty in being placed, so they are handled multiple times. But nowadays we use what is called as the implanter. The implanter is an instrument where there is a needle with a plunger behind it. There's a sleeve there where we place the graft inside, and we place the needle inside. The needle provides a pocket there, and when I press the plunger, the graft is securely deposited at the depth that I want without any handling there. The only time the graft is handled is at the time of extraction and when placing it, so the amount of time that it is handled by people is reduced and the chances of it getting injured is reduced. Again, when multiple implanters are used and I use multiple people to load up the implanters, the time is drastically reduced from 2 to 3 hours to almost 1 to 1.5 hours for 2000 to 2500 graft sittings. When all these things are combined together, the amount of results that we see with the graft growth after a FUE is almost at par at what we see with the FUT. So as of today, with very good equipments, FUE is giving FUT a very good run for the money, and maybe in a couple of years we probably will not have a scarring technique like the FUT going around.